Hi, I'm Bob Adams and I'm a respiratory and sleep physician and Professor of Respiratory and Sleep Medicine at Flinders University. And I'm here in the lab at the Adelaide Institute for Sleep Health with Associate Professor Amy Reynolds, who is a professional psychologist and clinical epidemiologist and sleep researcher. So we're here talking about insomnia and sleep apnea, and I'm going to hit you with a few short answer questions that I want a yes, no, maybe answer.
Fire away.
Excellent. Question number 1. Is it common for people to get both sleep apnea and insomnia together?
It absolutely can be.
Okay, question number 2. If you have sleep apnea and insomnia together, do people tend to have worse health outcomes?
There is some evidence that there are worse health outcomes if you have both conditions.
Okay. And number 3, how good are we at routinely picking up both of them when they occur together?
We've got some work to do in that space.
Very good. All right. So what we might do now is talk a little bit more about the insomnia and sleep apnea condition. And tell me, what do you think are some of the more common and usual symptoms that people have when they have both of them together?
You can probably speak to the sleep apnea symptoms better than I can, but what we see when we've got two of these conditions happening at the same time is we are going to see some overlap. We're going to see some presentations. Often people will go because they're snoring or there's a bed partner telling them that they snore and they need to go and see their GP. They might also have some of those features of insomnia that we know occur. So difficulty getting to sleep, staying asleep, or waking early in the morning and having trouble getting back to sleep are the common nighttime symptoms of insomnia. And then we've got that overlap into the daytime. So it's less common, but not uncommon, for people with insomnia to be sleepy. But when you've got both obstructive sleep apnea and insomnia, more likely to see some of that sleepiness there, which comes with the sleep apnea, and also difficulty potentially with how they're feeling during the day. They might find their mood is not as good as they'd like it to be. They might have more trouble concentrating or less motivation to do the things they need to do during the day. But I guess it's also important to recognize that if these two conditions are sort of ticking along together, some of those symptoms are going to creep up over time, and it can be less difficult to sort of, put your finger on when things got worse too. So.
Yeah, I think that's a good point, because we have tended to think that you couldn't have insomnia and sleep apnea together, and that people with sleep apnea are sleepy and people with insomnia are difficult getting off to sleep. But, we know that maybe 30 or 40% of people can have both, and those symptoms tend to merge across a little bit towards the end. So it's worthwhile thinking about whether you have the other if you're having a problem. So if you've got the both of them, insomnia and sleep apnea together, what are the health outcomes like?
Yeah, we do see there is some evidence that's been really sort of more recent actually that suggests that if you've got both insomnia and sleep apnea, there might be some worse outcomes in terms of your physical and mental health than if you just have one of the conditions in isolation. So it's probably not surprising if you're having difficulty with your breathing stopping many times a night, but you're also then having trouble getting to sleep or staying asleep when you do have an opportunity to sleep. That's really going to make things pretty tricky when you're trying to get up and do all of the things you need to do during the day.
Yeah, and some of that recent evidence, as you say, it seemed to show that people with the two conditions occurring together have increased risk of hypertension and heart disease.
Yep.
And that can link to worse outcomes down the road and even mortality. Good news part of the story is, though, treatment. Can we manage both?
We certainly can, although when we talk to patients in our research, we do see that potentially it's the sleep apnea that might get their attention first. It might be the thing that drives them to the GP, especially if they've got a bed partner that's telling them that they're snoring and they need to do something about it. And then potentially some of those residual insomnia symptoms, maybe that's the reason they go, or sometimes they're a bit trickier to sort of pick up and do something about. But I think the important thing here is actually recognizing that if you're being treated for a sleep condition and you still got some symptoms of, having trouble getting to sleep or staying asleep, for example, there may be other treatment that needs to be initiated in there as well. So simply treating the sleep apnea isn't necessarily going to resolve those insomnia symptoms. There are a different sort of course of treatments that we need to put in place if that's the case.
Yeah, so I think that's a good point. We have good evidence-based treatments for sleep apnea and insomnia, and you can use the two of them together.
Absolutely.
And they work for fixing or helping with both conditions. And as you're saying, if you're still having residual symptoms, it's worth thinking about, is the other having a problem and causing the problem with you, and checking that with your GP. And I suppose the other point to make is, of course, most people with either sleep apnea or insomnia only have sleep apnea or insomnia, and they can be treated for that. But there are quite a few people in the middle have both, and that needs to be thought about. So, lastly, what's one key thing that you do to prepare for a good night's sleep?
Well, I do both sleep and circadian research, and a big part of that is recognizing the role of light in our lives. So in our house, when the sun goes down, it's nighttime. We keep the bright lights off, the dimmers come on, and that's because we know too much bright light at times when our bodies are meant to be resting is not so great for sleep. So nice and dim from the time the sun goes down in our house.
So bright light during the day, dim light at night.
Absolutely.
Okay.
We follow the sun. And how about you, Bob? What's something you do to prepare for bed at night? I
try, not always succeed, in having a regular sleep schedule so that my clock is working at the way at times it should be. And I've been known to spend too much time on my phone and try and get off that a good hour beforehand so that my mind has a chance to relax at the scheduled time that I want to go to sleep. So, Amy, thank you. It's been great.
Thanks for the time.
Thank you.